learned a few things about being a patient. You need to be your own advocate. You need to keep track of what's going on. You need to do some research on what they propose. And you need to ask them questions, the doctors. What is my prognosis? What are my treatment alternatives? Am I better to be medically treated, such as medication, shots, physical therapy, or a surgical intervention? And how do you project my outcomes? Then, go talk to your primary. What do you think? What do you know? You can always get a second opinion. You have to talk to your insurance. Get to know your insurance company. Have their number on speed dial. Have your patient ID number on your card number. And get to know their system. If you have issues and you're going to a doctor, you need to get yourself a folder. If you have multiple doctors, you need to get dividers. You need to make notes, keep copies of things. Any questions you have, you put on a little sticky note for the next visit or the next call. I still old-fashioned do the little calendar book that fits in my purse, and if I make a call to my doctor's office, I open that up, and if I have any sticky notes with questions, call your doctor or your health insurance, making sure it's all covered. And sometimes certain insurances, one insurance I had a great nurse advocate you could call and ask for help if you had concerns. That's a whole other video I'll have to tell you about down the road. But anyway, don't just rely on the doctor's offices, especially if you have insurance and go to private clinics. They do not generally communicate with each other. You, the patient, get your copy of your records and you transport it. You get x-rays, you get the CD. You bring it, you show it, you let them implant it into their computer systems. You are your own advocate, and that's the way it has to be. If you're in part of a big system like Kaiser, okay, not so much. But if you have United Healthcare, Aetna, Blue Cross, and you go to private doctors with their own offices, they do not communicate. There are so many doctors out there, and your insurance may send you to Dr. A, and then your doctor may know Dr. B, but then also maybe there's Dr. C. Well, you need to be able to carry the information from one doctor to another. If they have any questions, then they can call your doctor's office, and typically that's what happens. So, getting a hold of CDs from radiology companies, getting copies of notes and putting them in your folder, keeping track of your appointments, calling your insurance companies, asking if they have any nurse advocates that can help you. You must be your own health advocate. I got here. It only took 20 minutes to go 7 miles. Rocks. Anyway.